As I was laying there in that bed, unable to breathe, struggling to breathe, in a tripod position, I realized that my nurse was not going to do anything, and I knew that I was dying. Hey y'all, so I wanted to preface this video by saying that this is my own personal story of a horrendous hospital stay, and I thought with all of the videos going up of good nurses walking out, these are the kind of nurses that we're left with. So towards the end of the video, I give you 3 tips that you can follow if you want to survive your next hospital stay. So let's get into the video. So we've all seen the videos on TikTok and YouTube about how nurses are quitting, and unfortunately it's good nurses that are quitting, which leaves us with what's left. And I have a story for you, and it is my own personal patient horror story describing this very scenario. So I was a patient in a hospital in Crestview, Florida back in 2018, and I had a cough for a while, and this was January, and I want to say that I had been coughing off and on since November, since right after Thanksgiving. And on this particular day, it was a Friday, I had stopped and called my husband because I had one patient left. I was doing home health at the time, and she was in a facility, and he said, you know, honey, you really don't sound good. I don't think it would be a good idea for you to go into a facility. And he asked me where I was, and I was parked right across the street from the hospital because the facility I was going to was just right up the road. So I called into the office and I explained what was going on, and called the patient to let her know that I wasn't going to be coming. And she was okay with that, didn't want to reschedule, didn't want another nurse. So I went on over to the ER. No, I take that back. I first went to the house because my husband wanted me to pick up our girls and take them with me. And so I went home, I changed out of my scrubs, and as I'm waiting on the girls to get their things together to go with me, I decided to lay down on my bed for just a minute. And I remember thinking how wonderful it felt just to lay down. Now at this point, I was not running a fever. I was just tired. And so the girls got ready. We went over to the ER. My husband, who was a captain paramedic at the time in the county where we lived, he came on over to the hospital and just to kind of see what was going on. And so I get there and they do a chest x-ray, they draw some labs, and the doctor comes in and he says, you have double pneumonia and I really need to admit you to the hospital. Now, of course, being a registered nurse, my husband being a paramedic, I thought, okay, so I asked him, I'm like, well, can you just give me a round of antibiotics here, maybe a shot of Brosephin or something, and give me a prescription for some oral antibiotics and just let me go home and recover there. And he says, no, I'm not comfortable doing that because it is in both lungs. And he said, honestly, I don't know how you're not septic right now. He said, if you're not, you will be. And so that's why he didn't want me to go home. So as we're sitting there waiting on the lab results, I had to go to the bathroom. And so my husband was walking with me, and y'all, just from the time that I left the bed there in the ER, before I could get to the end of the hallway to the bathroom, I spiked a fever of 102 point something. I want to say 0.4, but it was over 102. Sudden fatigue, and I just had to lay down. I told my husband, I'm like, I just suddenly got chills and I just want to lay down all of a sudden. So we got back to the room, you know, he was feeling in my face and he's like, you just spiked a temp. So he went and got my nurse. Long story short, at this point, I got admitted to the hospital. So at this particular hospital, and as at most hospitals, they have a sepsis protocol that they follow. And the thing that I don't like about protocols is it's putting a blanket treatment for all patients, and you can't do that. You have to treat your patients on a personal basis. So what they began doing was flushing me with IV fluids, which is part of the protocol. After a couple of days, it might have been even 24 hours, the pulmonologist came to see me and looked at my recent labs, listened to my lungs, and he felt like the IV fluids were making the pneumonia worse, and I knew I wasn't feeling any better. So he wrote an order to discontinue the IV fluids. Now, I didn't know that at the time. I remember that he said he was going to stop the fluids, but he didn't say when, and he did not say that he was writing an order that day. However, before he left for the day, he did write that order. And the nurses there did not acknowledge the order. So another 24 hours goes by, and I really start feeling bad. It's really starting to hurt to breathe. I started having to go to the bathroom more frequently. I couldn't get comfortable. I wasn't comfortable laying down. I wasn't comfortable sitting up. And I kept telling my nurse, it's getting harder and harder to breathe. And she would come in and she would check she would take the pulse ox and put it on my finger. It's the little thing that has a red light in it, and it tells the staff how much oxygen is in your blood. Top end is 100%, of course, and mine was at 97, and I was on 3 liters of oxygen. So I told her, I said, it's really getting harder to breathe. So she turned my oxygen up to 4, and she says, I'll be back to check on you in a little bit. So another few hours goes by, and it's not getting any better. And I'm having to get up and go to the bathroom every few minutes. I'm exhausted. And this particular time when I got up to go to the bathroom, I had already started to urinate in the bed. And what was happening at that point is my body was not able to handle the amount of fluid that they were putting into me. So at that point, I did my business in the bathroom, and then I went to get up to go back to the bed, and I couldn't make it. I leaned over. I was about to pass out. I grabbed it. There was a handrail on the wall across from the toilet. I grabbed it, and right behind that was the pull cord for, to get the assistance. So I pulled that cord. So I'm sitting there about 10 minutes, and finally somebody comes into the bathroom, and it was my nurse, and I told her, I was like, I can't breathe. I can't get to the bed. I mean, the whole 9. And she was like, well, okay, come on, I'll help you get back into the bed, and just not concerned at all. And so she helped me get back in the bed, and she wasn't offering, so I said, please get an order for a catheter, breathless. And so she said she would. So she went, she called the doctor, she got an order for the catheter. So what happens at that point, when she gets a verbal order, she has to go into the chart and write that order out. So we know just from that alone that she was in the physician's orders, and apparently nobody had checked them. And you're supposed to sign off on the orders. And what happens is you usually have a unit clerk, and when the physician writes an order in your chart, she will flag it and put it up on the counter in a rack so that your nurse knows that you have a new order in your chart, and they have to sign off on it behind the doctor. So I don't know what their process is, but I just know that order to DC my IV fluids was not acknowledged. So I tell her, I'm like, I really can't breathe, and I was telling her how bad it hurt. Y'all, my lungs, it felt like every time I tried to take a breath, it was like I had sand in my lungs, and every time I expanded my lungs, it was just like scratching in my lung tissue. It hurt so bad, y'all. And I didn't know that not being able to breathe was actually painful, but for me it was. And that was because the sandy feeling that I was describing is from the saline crystals that's in the IV fluid. They're actual crystals, and they get into your tissues. So she again turns my oxygen up, so I'm at 4 liters at this point. And she says, well, I don't know, this says you're at 97%, and I guess I can go and get a new pulse ox and try that. But y'all, here's the thing. In nursing school, you're taught that your machines are a tool. You still have, you're not treating the machine, you're treating a patient, a human being. So if your machines and the symptoms that your patient is presenting are not coinciding, you go based off of what you're seeing in your patient. This nurse was not doing that. So she had a couple of options at that time. She could have, number one, went and called the doctor, which she didn't do. She could have called Respiratory, which she didn't do. She could have called Rapid Response Team, which she didn't do, because even if the O2 monitor was not reading correctly, my heart rate at this point was out the roof. So she should have called Respiratory. She should have called Rapid Response Team. There are so many things that you can do where you're not making a judgment call by yourself. So at this point, I'm sitting there in the bed. I can't breathe. It's not getting any better. I knew, as in my nurse mind, even though I couldn't articulate it to her, I knew that I was going into respiratory failure. And I knew that if I didn't do something, that I was going to die. I managed to pick up. Now at this point, I'm sitting in the bed. I'm holding on to the bed rails. I'm in a tripod position. And again, this nurse is nothing is clicking with her. So I managed to get my cell phone off of the bedside table. I found my husband's name, and all I could type was, I sent him a text. I said, help. And so after a couple of minutes, my phone rings. Now this is early morning at this point, and my husband was getting ready to go into work, so it was sometime between 6 and 7 in the morning. And so he calls my phone. I can't talk, which, thinking back on it, I should have tried to talk to him so that he would have known exactly how bad it was. But she goes, yeah, she wanted to call you. I think she wants you to come up here. And I don't know what was said on his end. And then she goes, yeah, she's having a little bit of a hard time breathing. And I'm thinking to myself, a little bit? Bitch, I can't breathe. And in my nursing brain, again, I'm thinking, she keeps referring to the oxygen. Oxygen was not the problem. So when you breathe in oxygen. When you breathe out CO2. And so there's a gas exchange that happens. I was not getting out all of my CO2. So while my oxygen level was 97%, because no shit, Sherlock, you've got me on 4 liters of oxygen right now. Well, I've got all of this going on, and still, this nurse is not getting a clue. So my husband finally comes in, and at this point, I am borderline in a hypoxic rage. I'm sitting up in the bed. I'm still holding on to the bed rails, and I am just like, it was awful, y'all. It was, I don't know if you have never not been able to breathe, but it is the worst feeling in the world. There are no words to explain it. He took one look at me, and he backed out of the doorway, and he went to the nurse's desk. Now, from this point on, a lot of things I don't remember or I didn't hear. So this point of the story is based off of what I was told later. So my husband went to the nurse's desk. My nurse wasn't there, but there was a nurse at the nurse's desk, and he said, hey, I need somebody to come check on my wife. She can't breathe. So the lady turns around and she goes, excuse me? And he said, My wife can't breathe. I need somebody to come and check on her now. Y'all, this nurse rolled her eyes at my husband, a captain paramedic of 30 years, rolled her eyes at him and turned around and faced the computer. She did not pick up the phone and call anybody. She didn't say, let's call respiratory. She didn't get up and go check on me herself. She turned her back on my husband after she rolled her eyes at him. So I was in a semi-private room. I had a roommate, and apparently a physician had come into my room, and when my husband was walking away from the nurse's desk, he said, hey, doc, my wife is going into respiratory failure. Somebody needs to check on her. Y'all, the doctor did not even acknowledge that my husband said a single damn word. He kept walking. And he said, doc, I need your help. Not a single word. He kept walking. So my husband goes, okay. So he was familiar with the hospital's administration because as a captain for the paramedics in the county where we lived, they have pretty much weekly meetings, sometimes bi-weekly, sometimes once a month, depends on what the meeting was about. So he knew the CEO, and he knew where the CEO's office was. So he walks into the CEO's office, walks around his desk, gets in his face and said, I have asked a nurse at the nurse's desk, I asked a doctor in passing to go and check on my wife who is here in your hospital and she can't breathe, and I can't get any damn body to go in and check on her. I get a doctor in her room right now. And so the CEO goes, oh, okay. And so he calls the pulmonologist. The pulmonologist had just gotten to the hospital, so this was like early morning, y'all. The pulmonologist comes in and takes one look at me, and he's like, oh my gosh. And so he goes out. He's talking with my husband. My husband wants to transfer me out of the hospital. He was about to call his team to come and pick me up and transfer me to Sacred Heart over in Destin or Panama City, wherever that Sacred Heart is. He just knew he wanted to get me out of the Crestview Hospital. So the physician said, I'm going to have to intubate her, and my husband immediately said, you will not intubate her in this hospital, and I can promise you, if you do intubate her, I promise you she will be transferred out of this hospital because she will not stay here intubated. So y'all, this hospital has a very bad reputation. It is one of the top 10 most expensive hospitals for profit in the United States. The top 10 in Crestview, Florida. And you don't want to go there if it's something serious or traumatic. Now, at the time, we didn't realize that it was going to get this serious. We thought I just had a cough. I'd go in, be seen by a doctor, get a prescription, and go home, or I would not have gone there. So the doctor is telling my husband that he wrote an order to discontinue my IV fluids. That did not happen. Y'all, I received 7 liters of IV fluid after that order was written. They were killing me, and nobody was doing a damn thing about it. So my doctor is I can hear him out in the hallway. Why hasn't respiratory been called? Why hasn't rapid response been called? And he's questioning these nurses, and he is not being quiet about it. So respiratory gets called. They come into my room, and it's this little bitty short, teeny tiny girl with a BiPAP machine. So the doctor said, before you transfer your wife out of this hospital, please let me try the BiPAP. He says, I think that this will give her some relief, and I think it'll push all of the fluid out of her lungs. And, let's see if this works first. And that's because he knew it would look bad on the hospital, for us to be transferred out, or for me to be transferred out. And in order for me to transfer out, whether, they would have intubated me in order to transfer me. But he wasn't quiet about it. So he steps out into the hallway with my husband when the respiratory therapist comes in. Now, you got to understand something. I already cannot breathe. I'm struggling. I'm scared. I'm borderline hypoxic rage. And she comes at me with a mask. So all I knew in that second was that she was trying to cover my face with something. And I knocked her hand out of my face because I was just struggling to get my next breath. I wasn't really coherent enough to know what was going on. So she simply just turns the machine off, hangs the mask up, and she's just la-di-da-di-da, out the door. And according to my husband, because I didn't hear this, the doctor asked her, why isn't she on the BiPAP? Well, she didn't want it. She slapped it out of my hand and just kept walking. So the pulmonologist comes into my room himself. He gets in my face and he said, if you do not put this mask on your face, you are going to die. Do you understand what I'm saying? And I remember shaking my head yes at him. And he said, now I'm going to hand you the mask and I want you to put it over your own face. And so I did, and I realized, okay, I can still breathe. He said, now I'm going to turn on this machine, okay? And I shook my head, okay. So he turned the machine on. Y'all, as soon as he did, I had relief. And he helped me get the strap over the back of my head. And I just remember falling back into the bed, finally able to get air in and out and not be in pain. And I remember them wheeling me out and my husband saying, we're taking you to ICU. So this happened on day 2. I spent a total of 8 days in the hospital. So 6 days were in the ICU because the nurse did not acknowledge a physician's order. Because a nurse was looking at me struggling to breathe. She was watching me decline. She knew I was tanking. She should have known that I was going into respiratory failure. I was about to die. And had I not texted my husband, I wouldn't be here today because I had nobody there in that hospital with me. My nurse was not listening to me. She was not putting 2 and 2 together. Why she was not acknowledging what she was seeing, what I was presenting as her patient, I have no idea. So my tips for you is the next time you or a loved one has to go into the hospital, take someone with you if at all possible. Take a notebook and a pen with you. Write down everything. Write down what time you're taken up to your room. Write down who your doctor is, who your nurses are. Even your patient care tech, the person that comes in and checks your vital signs. Write all of their names down. When they come in to give you medication, ask them what they're giving you, because you're not going to believe this next thing I tell you. Write down what they're giving you, how much they're giving you, what time they're giving it to you, and why they are giving it to you. They are supposed to tell you those things. And if they don't, ask them. Because my neighbor, before they moved me to ICU, was there for diverticulitis. She had morphine and Dilaudid on her EMR, on her medication list. I remember her telling her nurse was offering her the pain meds and asked her, did she want the morphine? And she goes, well, the morphine's been giving me a headache. Can I have my Dilaudid? Well, at some point, I had been given Dilaudid twice. And I remember thinking, why am I getting a pain medication. I mean, I know that my nursing brain is aware that it is a nervous system depressant and that I shouldn't be getting it. But what happened was, down in the ER, I had been in that bed for so long. I have lower back problems anyway, and my back was hurting. And so that physician gave me some morphine for my back pain. Now, why he didn't just have me reposition, sit me up, give me some Tylenol, who knows? But he ordered the morphine, and I guess it stayed on my chart. But I never asked. Once I got up to the floor, I was more comfortable, and I never asked for pain medication. But I told my husband later on, I said, I swear she came in a couple of times and gave me something, and I felt like afterwards, that feeling that I had just gotten a narcotic. So that had been going on as well. So not only did they leave the fluids running, but they were also giving me medications that I should not have had, being that I was already struggling to breathe. So there was that. When I first got to ICU, the nurses were great. I received the attention that I needed. I was able to get better. The last 24 to 36 hours, I had the worst nurse. My IV was leaking, and I notified her that it was leaking because, y'all, at this point, I was getting IV antibiotics. Yes, I was better. Did I need to be in ICU at that point? Probably not, but the hospital knew they effed up and they wanted to keep me there. So I think this nurse was ticked off about it. I said, my IV is leaking. My antibiotics are going all over the floor. I need these antibiotics. Y'all, it took me 3 hours to get, because I requested to speak to the house supervisor. I didn't even ask for the charge nurse. I wanted the house supervisor. And I said, I have complained about my IV leaking. You can see how wet this side of the bed is. I was diagnosed with double pneumonia, ended up here in ICU. I need these antibiotics. I do not want to regress back into, respiratory failure. And so she went and got the nurse. Y'all, it was not until 2 o'clock in the morning. She came into my room, flipping on all the lights, huffing and puffing to change my IV. And even then, her technique was the worst. I saw nursing students with better technique than this girl. She didn't hold pressure, so when she went to get the tape off the bed rail to tape the IV down, blood started running everywhere. It was running down my arm. It was running down onto the floor. It was on my bed sheets. It was awful. So that's why I say take somebody with you that can advocate for you, that can be your two legs and walk around and find help for you, even if she has to call 911, he or she. Because people don't know this, but you can call 911 from your hospital room. If you feel like you are in distress and you're not getting the help that you need, call 911. They have to respond, even if it's in your hospital room. So that's my advice for you. Take somebody with you, write down everything, and if all else fails, call 911. But y'all, these are the kind of nurses that are left in these hospitals. All of the good nurses with the good heart and that are doing it for the right reasons are quitting, because the hospitals are treating their nursing staff so bad. Registered nurses, in my honest opinion, should be making 6 figures easily in 2026 for the crap that we have to deal with and put up with. You have nurses who are being criminally charged because a patient was given the wrong medications when the hospital safety measures were down. She also had too many patients. That as a nursing student, I was given, not a nursing student, as a grad nurse, I was given 7 patients. 7. as somebody that was brand new. The nurses, the veteran nurses there, would chew me up and spit me out rather than teach me how they do things. You know, they've been there for 20 and 30 years. Get your new nurses and teach them. They're going to be the ones that are there after you're gone. But no, they didn't do that. But these are the kind of nurses that are there, and I'll have another video talking about some of the things that I have seen and heard about, and some avenues that you can go down with your RN license and make a hell of a lot more money than you make in a hospital, and you don't have the abusive treatment that you get. But until the hospitals stop being so damn greedy, you're not going to have good nurses. It's not a nursing shortage. It's a staffing issue, and they want to give you more patients than you can handle, because that's one less or two less nurses that they have to pay. Our healthcare system is severely broken. But anyway, guys, this video has gone longer than I intended it to, and I appreciate you watching, and I will see you guys on the next one. Bye, y'all.